So what is the craziest thing that you have done out of love?
Oh. You're bringing some memories. I'll be very honest.
Is it the general love or the other love?
Yeah, I was caught.
If I had the chance to document Bena Care Story, it will be to document the kind of impact Bena Care is having on the ground, the kind of patients that have been impacted directly by Bena Care nurses, the kind of services Bena Care offers, all as a story of love.
Our systems in healthcare are deteriorating, and someone has to stand in the gap of the healthcare systems that are bankrupting people.
Healthcare is not leisure. It's something someone will actually need at some point in their lives. And if they can't afford it, they might die.
As a finance person, we talk more about money, but after working here, I've seen it's good to go beyond the money and see the impact that you're offering in the society.
Bena Care is changing that narrative that there is no other alternative.
I was working as a student nurse, and then I came face to face with the very harsh realities of long-term care, very expensive healthcare, and the effects this has on the patients and their families. And I thought there has to be another way to deliver healthcare without necessarily bankrupting people. And so Bena Care came up.
We are focusing on 3 main pillars. One of them is our health research focus. The other one is about our healthcare that we give. And the third one is now the new introduction of the renal roads, which is a mobile dialysis project.
Here in Kenya, the hospitals at times they are so congested, and sometimes patients need some privacy. That cannot happen in the hospitals. At times you'll find in one bed, maybe you are 3 people, maybe you are 4 people. But you know, now when Bena Care started the home-based care at home, you concentrate with one patient. He or she can openly talk to you about their condition.
In home care, it's so personalized. A nurse is with the patient at all times. So that automatically brings out better healthcare outcomes, and that to us is the biggest impact.
Bena Care deals with those who are less fortunate in the community, those who have gone through emotional and financial constraints in the hospital. Bena Care has come like a source of support to these people.
This is a 17-year-old that we took care of. She had a brain tumor, had undergone 5 brain surgeries, and she had lived in hospital for 2 years of her life. She was still in high school, you know, in and out of hospital for 2 years. And when they were finally able to know that there's a service that can come home for the management and all that, because it was also end of life, she was very happy to be home and to receive care at home. And the nurse bonded really well with her, and I think she had an amazing time. Over the years, we have noticed that there's a growing trend in our patient population where a lot of patients are in need of dialysis services because of the chronic kidney disease. We conducted a study with Jomo Kenyatta University, and the study revealed critical gaps, first in patient care and also prevention strategies. Most of the patients travel long distances to access dialysis services, which causes a problem with access, because then there's a lot of drop-offs from the treatment plan. So we went back to the drawing board, and then we came up with a different model that is able to deliver these services closer to the people. So we'll be hitting the road with mobile dialysis trucks that will serve people in remote and hard-to-reach areas of Kenya. And this is the first model of dialysis delivery in Africa, and we hope that this will actually inform how renal replacement therapies are conducted in Africa as well. So I'm proud of this milestone.
Penetrating into the community, we normally have some medical camps that we do. You find that the government of Kenya maybe will do something like a medical camp maybe once in a year, but even in a month we could have 2 medical camps. Like right now, we were working on cancer screening. That is the #1 killer on our women. You find that other communities, they are not aware at all. And we have created awareness in the community. We have trained other nurses who did not have knowledge on that. So when we go to the community, we find that many have defaulted. No one educated them. That is what we do when we get now to the camps, because we have people who will talk on that, on those conditions, tell them the importance of why they're supposed to take their drugs on time, because you know conditions like diabetes and hypertension, they normally go together. If you don't curb and prevent the other one, it will lead to another condition.
We cannot continue working according to the old ways. We need to keep improving so that the care that we provide to patients gets better and better. We are always going to find better ways to serve the people.
My work at Bena Care means a lot to me, especially it's touching on human lives. So we visited the young girl. She had an accident. She had a spinal issue. When we got there, the family didn't know what to do. She was being transferred using just a flat timber. We came in, brought in an electric bed to support her, and we brought in a nurse. And after 1 week, we got a call. She was doing better. There is some satisfaction that comes with it, especially knowing that you have assisted someone with the healthcare need that they needed.
What we see with Bena Care is a company that has cemented its place in Africa as a change maker, a change leader, because all the time we hear people talk a lot about the plans that they have for the continent of Africa and the people. But Bena Care represents a very obvious and realistic explanation of that change, and it's visible. The impacts are all over the place. We see the lives that are being touched, not just the patients, but even the lives of the people at Bena Care. Representing the board, it's incredible to see that the decisions that we help the CEO make at the board level are being implemented, and we have people at the center of these decisions. It is not just about strategies or just what the data is saying. It's about what the people need. The people in terms of our team, the people in terms of our partners, the people in terms of the patients that we serve, the people that get inspired by the journey.
Once you meet a beneficiary of the work that we do, then you're convinced that this is the right thing to do.